Hey, it's the 16th, and I didn't sleep horribly last night, but I'm still feeling just fatigued today, tired. I woke up with a headache. My CPAP pressure went to an 8, and it was pumping me full of air. I was getting a little bit nauseous. I woke up a little bit. But 8 is better than the 10 it was a few days ago. So maybe some inflammation behind my tongue is going down or something. My tongue still or my chin area where they did the osteotomy still kind of hurts, is sore, and also, just feeling the lingual obstruction and tingling and uncomfortable tension sensation. Really don't like that. Triggers me, makes me anxious. I want to lift weights today. I wanted to lift weights yesterday. It's been 2 days since I lifted, but I need to be patient and not screw myself over. I'm gonna try focusing on meditation. If I can't make the muscle gains, I'll make the brain gains. Focusing on focus. Yeah, just not feeling as good as I wanted to. My mood is kind of low, and I don't normally have that problem. Trying not to obsess too much over what to do. It's not a now problem, it's a future problem, and I'm already doing the best I can. So I really just need patience and self-compassion. Take things slow. I want to go back to weightlifting. I want to go back to work, get my life back on track, but it doesn't happen just like that, unfortunately. Hey, it's July 20th. Life goes on, and the sleep has been better the last few days. It's getting quite consistently good. I'm pretty much sleeping through the night. Maybe there's a little bit tossing, turning, and there's less headaches in the morning. Although it's there, I still get some headaches throughout the day. I feel like my face, my soft tissue is just adjusting. Just feel it right here. I'm more functional. I'm able to do things like today I went for a nice bike ride. I went to the library to do some homework. I finished one necessary chore, and I started looking into another one. There's some things that I feel like kind of like went away after the surgery, like nasal congestion. It wasn't like I think right after the surgery, well, allergies kind of like, it wasn't a thing at all. It's still not a thing. Like, I don't like get stuffy early, like not like reacting to the pollen outside for whatever reason. I was worried I was gonna like be sneezing after the surgery and just my face would fall off, but uh, it took a while for a sneeze to actually happen, a couple weeks I think, and yeah, it was painful. So I'm like, oh, I don't want to do that again. No. So the allergy sneezing hasn't really been a thing, and my skin was actually really good after the surgery. No acne. I'm like, what the heck is this? But like I noticed it's starting to come back again after like 3 weeks, 2 weeks, getting a little bit of like zits around here. Maybe it's because of the CPAP mask. Yeah, I'm still using the CPAP. I lasted 2 weeks without it, and there was that one day where I thought my lingual muscle detached from the bone, and maybe there was a few strands, some inflammation, and the pressure on the CPAP and went up to 10. And then it went back down to like 8, and then like 7, and now I'm like last night I think it was at like 6.7 or whatever. So it's going down, and I think I still need it, unfortunately. But yeah, just taking it day by day. There's just so much I'm anxious about. A little bit of there's some um, little episodes of low mood and actual depression. And I haven't had that like in a long time. But I think it's understandable. Um, and yeah, a lot of anxiety also about all the about everything. And also, it's also understandable. So I'm doing my best. Lots of ups and downs. Um, Eating more solid foods now. I'm trying to do at least one meal a day solid food. Like today, I made some scrambled eggs, like an omelet with some mushrooms and onions. It was good, and some cheese. Yesterday, I had some pasta and meat my sister made, and the day before, I had some chili my mom made. I have to be careful I don't chew on my lip. I think I hurt this lip a little bit. It's starting to hurt here. And, yeah. It's July 22nd. And I didn't sleep that well last night. My CPAP pressure was on automatic titration from with a range of 6 to 8. So not that wide, but it was at 8. Probably wanted to go higher. So for whatever reason, I was obstructing. I think my tongue was really falling back in the back of my throat. It just does not want to stay to the top of my mouth there. Tongue too fat. I went for a bike ride though, and I'd had a good couple nights before, last night. Trying to eat healthy, see if I can lose any more weight. That might help. But I just want to go back to work and get my life back on track. It's been since March, April, May, June, July. It's almost half a year that I've been off work. That's messed up. I was trending positively, and I was like thinking I can go. I was thinking I might go back if things were like that. But after yesterday, it's like, oh no, I can't now. And if I go back to work, then my health will suffer. I won't have enough time to exercise or to eat healthy. I'll gain weight again. My sleep will suffer. It'll become a vicious cycle again. So I'm sad this jaw surgery wasn't as effective as I thought it would be. The systematic review said 40% cure, 85% success rate. Maybe it was successful, I don't know. I feel similar to right after I started using the CPAP 2 years ago, almost. Similar level of functionality, maybe even worse. For whatever reason, I don't even know. Don't like the chin thing. Maybe it's making my tongue weaker. It's falling back more. Lots of regrets. I should have done this. I should have done that. Should have done the expansion and maybe even open up the extraction spaces. Right when I got my CPAP. Should have never gotten the premolars extracted when I was a teenager. Should have had a lingual frenectomy when I was just a baby, and myofunctional therapy. So my jaws, my face would develop healthy airways. So many regrets now that I've learned some stuff. This part is very far and very far. So like I'm wondering if I do the transverse expansion, is it really gonna go like this? I don't know. There's quite a lot of space between my front teeth and my lip though, but I'm biting my lower lip, I feel like. And it's numb, so I need to be careful when I'm eating. I'm still on a liquid diet because eating solids is a big ordeal. Numb here, tingly here, and the tingly is just the worst feeling ever. Is life. I'm hopeful, and I'm happy I went for a bike ride today and got out in the sun. Hey, it's July 24th. I'm tired and I have a headache and I feel bad. Yeah, the last couple days, symptoms seem to be getting worse. I don't know why. I think my tongue is just too big. It falls back into my throat. I want to go back to work, but I don't think I can. I don't even know if doing the palatal widening or opening up the extraction sites would help. I think I might need to get the midline glossectomy just to make my tongue smaller. It's July 25th, and I slept really bad again, like the third day in a row. I feel just so lobotomized. I had to take an Ativan last night. I woke up at 4 a.m. and just lied there at 5 a.m. feeling really tight and tense. I'm just really disappointed at how this jaw surgery went. It was way worse than I thought it'd be, and way less effective than I hoped it was. So, fuck. Hindsight 2020. I did my best. You know, the freaking systematic reviews said 40% cure rate, 85% plus success rate. I don't even know if it had any effect. You know, I lost 15 pounds and that probably helped, but my tongue is just too fat. It just falls to the back of my throat and clogs it up. I think when I took the premolars out when I was a kid, it complicated my case. I don't fit into the criteria for those studies for the jaw surgery, so it doesn't apply to me. So, man, I hate this so much. I'm like, just give me a midline glossectomy and just take out a chunk of my tongue. But honestly, that scares me more than the jaw surgery does. Just tongue paralysis, chronic pain. Yeah, I don't want to do that. So I'm taking the long route with orthodontics, widen my arch, my bite, palatal expansion, open up the extraction sites, get implants put back in. I think that'll have an effect, and if I'm not cured after that, after a year or two and thousands of dollars, then we'll get a chunk of my tongue taken out. Yay. Hey, it's July 26th, and I didn't sleep too bad last night. Obviously not too good either, but yeah, I'm just walking around downtown Coquitlam. There's a little park area with some water, and I'm eating a mango peach protein smoothie. It's a bit weird flavors because they didn't have
the normal flavors they had, so they just mixed whatever they had, but it's actually really good. And I'm here because I just consulted with an orthodontist, just a random orthodontist. I googled orthodontists in the area. I emailed them my situation. They booked me in, and turns out I saw this guy back in 2003 when I was like a teenager, when I had before I had my premolars taken out, just a consult. I think he didn't do the main work, but he knew the orthodontist I saw. He doesn't know if he's still around or if he's alive even, but he was very kind. He took like an entire hour just to talk about my case and counsel me, and yeah, he referred me to a good ENT oral surgeon as well, like who has lots of training in Langley. I tried to contact him. I tried to contact that one before, and they said they were just giving me some issues, and they wouldn't book me in. They needed a pen, they needed a Ceph, they needed orthodontist referral, and I'm like, gosh, I just need a consult. Like I don't have all these things. Leave me alone. And yeah, they're very demanding. And yeah, he's like saying he could widen stuff, but he's kind of old school. Like he's been around for a while, I guess. He's an old guy, but yeah, like he didn't charge me that much, and I wanted to pay more again, and I was a little bit late because the traffic was bad. He said he can widen, maybe open up sites for the for implants, the extraction space, just open up space for my tongue. He says it's uncertain what would happen. You know, it could have just like a tiny opening, could have a big compounding effect and make things wonderful, and I'll feel so good after opening up that space for my tongue, or nothing could happen. You know, it's all uncertain. The jaw surgery was supposed to be much more effective than it was, so yeah, he says we can try, and yeah, he says it's way better than any other option. We kind of agreed that was better than any other option. He says like you're not gonna it's gonna be hard to find like an oral surgeon that wants to do a midline glossectomy on you. Like that's not a pleasant thing. It's a dirty procedure because he says there's a lot of bleeding apparently. I don't know. Anyways, he's never had a patient do a midline glossectomy. Very honest, very caring guy. I'm glad I consulted with him, and he answered all my questions. He sat with me for like an hour and just talked about everything. He had another OSA patient recently who got off his CPAP. He lost a lot of weight. Yeah, I don't know. I guess. Like, I wish I saw him before the surgery, but at the same time, he's counseling me to just take it slowly, consult with the people I need to consult with, really get a good team working together with you before going forward. And, you know, pre-surgery, like, I just wanted to, like, I still want this thing to be over with. You know, I'm impatient. I want to do whatever to fix it. So, what am I gonna do, right? I'm trying to be patient. I mean, today's not horrible, but I want to go back to work, and I want to be off the damn CPAP machine and live my life. So, yep. I got the sleep clinic called me, and they booked me for this Friday, which is so early. It's not even 6 weeks. The sleep doc said September, but the front desk lady is just like, yeah, it just says to book you in, so whatever. And I'm like, oh, whatever, we'll see. So we'll get to see how effective or ineffective the jaw surgery was. Just a little bit bitter. Yeah. The orthodontist said today, like, it's very normal that the upper jaw is numb. It could take up to like 6 months to a year for everything to come back. And that's fine. He's like, yeah, he doesn't know about the genial tubercle advancement, the rectangular osteotomy. He's not that familiar with it. But yeah, he said the surgeon did a good job. He said my teeth aren't in horrible alignment, within the realm of normal spectrum, and yeah, well, I'm having some chin and tongue discomfort, chin pain today, like usual. And he said there's still a little bit of swelling up top. I don't know. But it is what it is. It's not horrible today, so I'm happy. And it's freaking hot today, man. Oh my gosh. My teeth look almost crooked. It's a hot one today. So that's July 26th. I don't know what I'm gonna do right now. My mom's at work, so maybe I'll just go home and play with the cats. It might be lonely. Hey, it's July 29th. I'm at the community center. I'm gonna go to the library to do some studying. I didn't sleep too bad last night. I'm somewhat functional. I went for a yoga class this morning. It's the first one I went to in years in a studio. And it was okay. Oh, my acne's bad. It was difficult at the start, and it was difficult throughout it. It was like a hot yoga class, so I was like sweating all over. It was crazy. Yeah, I felt good after. The thing that's bothering me most now is my lower teeth. I feel they're all kind of squished together, and they're like degrading or something. They look a little bit discolored. They feel just like sensitive, and like they're able to move, and just like tingly, and like sensitive kind of. And they just don't feel right. And yeah, upper teeth still kind of numb. I feel like when I tap it, it feels like something's getting tapped. But yeah, generally still quite numb in my upper teeth. And yeah, still getting chin pain, chin discomfort, lingual, weird sensations, tension, pulling, sensation of like tingling, weakness, and just yeah, I don't like it. And yeah, my acne's been bad lately. I need to like, maybe it's like dairy products, or maybe like the chocolate insure, the vanilla insure. Maybe it's just a change in the diet, not from when I after the surgery versus now. Allergies haven't been that bad, but I've noticed like my nasal breathing is much worse now, especially while working out. Like I had to change my breathing pattern when I was like doing some squats. Like instead of like I breathe in when I went down and breathe out when I go up, I breathe in when I'm up and go down and go up, and then exhale and breathe out. Kind of. So like it's like I'm holding my breath.
Thank you.
I was gonna do like a sleep study today. They called me and booked me in, but then I feel like it's too early. Like even like I feel like it's like the HI isn't gonna change that much. I'm still on the CPAP. And if I show my surgeon, yeah, like this is what my HI is, like after months, they'll be like, no, it needs longer. Like in the research, it's like 6 months after the surgery, just for the soft tissue to change. And you know, at first I'm like, what is this bullshit? What is this soft tissue changing? I don't even know what this soft tissue changing is. Like you move the jaw forward, and then your airway's open, right? Like the soft tissue can do whatever it wants. But I don't know. I'm just noticing like a lot of facial tension. Like I think like I've been clenching my teeth at night, I guess, since the surgery. I didn't do that before. I never had a problem. I think it's called bruxism. Yeah, and like I think I pulled like a muscle, or just it just feels very tight, like a facial muscle near my jaw. Yeah. All my facial muscles just feel so tired. Just tight, achy, kind of. I went for massage yesterday. It didn't help at all. I do like some foam rolling. It helps a little bit, but yeah, that's a whole big thing. Like right, like it's like whatever that facial muscle goes from here to like down. Yeah, it's like sore. Had a good face workout apparently. Yeah, so I'm gonna call the sleep clinic like in a couple months, maybe when I feel things have gotten more stable and have been adjusted. Do my lips look purple? My lips look kind of purple. I had a call with another orthodontist a couple days ago. I didn't talk about it then. He was cool. He was nice. He didn't want to charge me for coming in for consult, so he just gave me a quick phone call. And he does like a more holistic approach. He tries to avoid surgery as much as he can. He doesn't really do much surgery in his practice. He what is it called? Yeah, he's kind of like a woke dentist in terms of like airways and sleep apnea. He's like expansion and I don't know what the term is, osteopathic kind of focus. Just like his recommendation was like just myofunctional therapy for now, because like I just went through something so big, and he doesn't want to put any more forces on the area. Just let it adjust. ENT appointment next week. Just a phone call. I don't really know what we're gonna talk about over the phone. And another orthodontist appointment next week. This guy seems also very airway focused and aware. He's saying like he wants to do MARPI and possibly even reopen the extraction sites, but the MARPI, like it'll be like 6 to 12 months after the jaw surgery, I think, just to make sure everything heals up before we go crazy. But it'd be good to consult. I'm not sure when I want to do a follow-up CBCT, and I want to get like a video of my CBCT, because like I have a disc and it just never works whenever I bring it to places. Never opens properly. So I just take a video on my phone next time I go somewhere that can actually open it, and I'll do that with my second CBCT, and maybe to get it put on a USB drive instead of like a CD. I feel like my left side is more numb and tender than my right side. Thinking about going back to work, trying to find out what the best solution is, what the optimal path is. I have a few different options, but I want to do something that won't impact my health negatively. My diet's been okay, but my weight hasn't been dropping down anymore. Like I lost the 15 pounds, and maybe fluctuates a couple pounds down, a couple pounds up, and stable at like 180 right now. Tongue still feels too big for my mouth. My mom got diagnosed with mild OSA. I convinced her to do a sleep study. Her AHI was 9, and they were like, "You don't have to get treated." And I'm like, "You probably should do something. It affects you." So I referred her to the myofunctional therapist I saw, who was quite good. We'll see. And then we're talking about lingual frenectomies or whatever, and she showed me like she has no lingual frenulum. Like there's nothing there. I'm like, what the heck? Did you get it cut already? Like, what the hell? Like I have like a very significant one. Yeah, so I want to work towards getting tongue tie release, because I've learned that, like, yeah, the proper tongue position is suction to the roof of the mouth, and it's hard for me to maintain that. Like, I have to always have some tension in my tongue and jaw, and it's more conscious rather than a relaxed thing, and it falls very easily. So I'm excited for that. Hopefully it can make a big difference. And it's really weird because there's not good evidence supporting the lingual frenectomy for OSA. Well, that's all I can really think of to talk about right now. So if I remember anything, I'll check in later. I'm just praying everything will be okay. So I saw, he's just a general dentist, but he has some experience treating sleep apnea, some surgical experience, and orthodontic experience, and yeah, I did a good kind of assessment on me, and he just kind of gave me a path forward. Yeah, so like it's not like I'm gonna go do MRP or MRE anytime soon. Like, give it a long time, 6 to 12 months for the bones to heal. And he said my intermolar width wasn't too bad, and he could widen the upper jaws a little bit and untip the lower jaws to kind of widen the upper teeth a little bit with the MRP, and then the bottom molars are kind of tipped in a little bit, so that's how you kind of match the lower jaw with the upper jaw. He wasn't that experienced with SFOT, but he might be taking a course in the next couple months, and he referred me to a few other orthodontists who have some experience with opening up premolar extraction sites. But if I'm gonna do like some significant maxillary expansion, I think I need like SFOT for the lower jaw also, because there just won't be enough room for bone room to move everything, expand things, and open up those extraction sites if I do that. For now, he's just really focused on myofunctional therapy and eventually doing the lingual frenectomy. He says I do have some ankylosing, but mostly like midline kind of thing. It's like my tongue mobility is good, but it's like I'm getting like roof of or like floor of mouth compensation kind of thing. So when I lift my mouth, lift my tongue, the floor of my mouth also lifts. So it is kind of attached. So working towards lingual frenectomy with Laurie, with my myofunctional therapist. So that's gonna be a thing that I'm working towards. So feeling kind of good with the weight move forward. Didn't sleep that well last night either. I tried going to just a nasal pillow mask just to get like have stuff away from my face, you know, like I don't even know if the CPAP masks affect like the jaw development. Like if you're always having something around your jaws, like it's like kind of like pulling it back a little bit and makes the jaw smaller. So I wanted to go down to the nasal pillows only, but yeah, I just noticed my mouth kept opening, air kept coming out of my mouth. My pillow was drenched in drool. I didn't use mouth tape.
So I went back to the full face mask, and it's helping. Yeah, still somewhat symptomatic, but things are slightly better now, and still can't feel my upper jaw that much, but I think my sensation is returning to my hard palate, like slowly, starting from the back, moving forward. I can kind of feel my hard palate now, like right before my behind my front teeth. And there's some significant tooth discoloration. The dental hygienist and the dentist I saw just now said it was mostly from that chlorhexidine mouthwash post-surgery. It can discolor teeth, and after cleaning, it can go away. So I want to schedule a cleaning soon. My sleep clinic is still bugging me to go do a sleep study, but yeah, I told them it's just too soon after surgery. I guess they just have a list of people that need one, and they just go through the list whenever they have an opening. I'll try to get them to make them put a note there next to my name or something saying not yet, not yet. Yeah, I went to the gym and I had a pretty good workout. Nasal breathing is still difficult, so I'm excited for the MARPI, and I'm excited. I hear people do have much improved nasal breathing with functional rhinoplasty, functional nasal procedures. So that's gonna be down the line, far down the line. So not for a while, and I'm not looking forward to any type of surgery again. But it's an investment in my health, and I'm wanting to be functional. So that's what it costs. What is today? August 4th. Still haven't reached out to work to go back yet. Hoping to be able to do that soon. Yeah. I just what is it today? August 5th. I just had a phone call with my the ENT, and I'm feeling a little bit unsatisfied with his, I don't know, just practical experience with treating OSA. He's saying that the two options that he does or he recommends are just the jaw surgery and the nasal procedures. He wouldn't recommend any other soft tissue surgeries because they're not very curative. And he says, yeah, that's basically it. That's basically what he said. He didn't really offer much anything else. He said, I already had the second most effective and second most invasive option as opposed to the trach, and we don't want to do that, and there should be significant improvement. So touch base with him after, and then look into nasal procedure if I'm interested in that. So yeah, maybe it's time to look around for different ENTs who are more experienced with it. I told him what the plan is right now with the myofunctional therapy and the lingual frenectomy, and eventually with the MARPI, the palatal expansion. Maybe orthodontically opening up the extraction sites. He didn't really say anything to that. He just listened, and I don't know. I guess it's not that common that he deals with or he works with over time with OSA patients. So yeah, last night was quite bad. I'm very low functionality today. I wanted to go to the gym and have a good workout, but I'm just feeling lobotomized today. No reason. I feel like I was trying to do a little bit more myofunctional. This wasn't the only thing the myofunctional therapist recommended was air puffs, like blowing up my cheeks just to kind of relax the soft tissues. But yeah, I was like, I just like, you know, like I Googled like myofunctional therapy and different exercises and trying them out. And it feels like every single time I try any of those, I always sleep worse the night before. It worsens my sleep. So I don't know why that is. It's like I tire my tongue out and it just wants to give up and fall back into my throat after. So it's strange. Maybe the myofunctional therapist will shed some light on that. Yeah, so today kind of sucks. I also forgot to ask the ENT about the hyoid suspension. They didn't really comment about the genial tubercle advancement or anything like that, so yeah, I didn't really mention anything about that. So I guess I'll just talk briefly about myofunctional therapy as of now and mewing. I just recently learned about mewing. I went down like a YouTube dark hole in YouTube, just going from video to video until I finally found like this fad about mewing and orthotropics and the channel with that the Dr. Muse guys, and just learning about like proper resting tongue position, pushing it to the top of the mouth forcefully to widen the palate, especially when young and growing, to have proper nasal breathing, and just promote growth, healthy growth of the jaws and facial profile. And yeah, I think I always nasal breathe, but I think I've had, like even now, it's almost impossible for me to get the back of my tongue. They say the most difficult part about mewing is like, I believe, is getting the back third of your tongue to the roof of the mouth, pressing into it. And it's almost impossible for me because of my tongue tie. I don't have reduced, if you assess me, I don't have reduced tongue mobility, but the dentist I saw most recently says I have floor of mouth compensation. So when I'm lifting my tongue up, I'm lifting the entire floor of the mouth up. So it's like I got training weights. That's kind of funny. It's like I'm that what is that guy, Rock Lee from Naruto, with his training weights. You get my my lingual frenulum cut or resectioned, so I can maintain proper tongue position and have proper jaw kind of development. I heard someone say the best retaining device is the tongue, and yeah, so I think that really hampered me in my growth period as well. I think I had some pacifiers and some bottles growing up. I had the privilege of being breastfed, but also yeah, a lot of pacifiers and just thumb sucking. Also can maybe develop crooked teeth, and yeah, like even now, like my tongue is just so big, it's pushing more towards the front of my front teeth. It's like it's not resting like against at that spot, like behind the front teeth. It wants to push the front teeth, and like I stopped using my retainer, so I have like a little bit of a diastoma coming up just in these like 6 weeks since I stopped using my tongue retainer. And that's another thing that just messed me up completely. The 4 premolars taken out, everything retracted back, and they told me to they gave me a retainer to wear that I've been wearing with perfect adherence, like for the last 15-16 years. I've been wearing the retainer to make sure my teeth don't move. So there's one orthodontist that recommended this book. This book is called 6 Foot Tiger, 3 Foot Cage. And I just laugh at the title. I haven't read it yet. I really need to get my hands on it, but it's like, yeah, the retainer is just keeping my teeth in a cage, and my tongue in the cage, and impairing my airway, my sleep. So I'm gonna say I had 4 wisdom teeth taken out. So normally there's like 8 teeth on each side, 16 teeth up at bottom. I got 6 I got 12 teeth left because they took the 4 premolars, 2 on the top, 2 on the bottom, 4 wisdom, 4 on the top, 2 on the bottom. And so yeah, it's just there's lots of bone resorption, and then just perfectly positions my my jaw, my teeth to get recessed and to go back and to get smaller. So yeah, feel like I wish I knew this before. I wish this was more of a validated thing in the medical community, medical literature, because it really isn't. It's really it's almost pseudoscience, this new shit, this proper jaw development shit. Orthodontics is so it's almost broken in a way. It's very frustrating. It's just there's that there's a bias there. There's a profit bias. How are they going to make money off people if everyone just puts their tongue to the roof of the mouth when they're a kid and everything develops well? And there's also like, who's going to fund the study to prove that this shit works? But I don't know. This is still very controversial. Lots of sketchy posts. Some people say it works for them on YouTube. I don't know. But yeah, I've been doing that last little while. I was really not, well, I mean, after the surgery, like, I was so anxious with the lingual sensations, the genial tubercle advancement with the rectangular osteotomy in the front of the chin. That was crazy. And like, I was just so worried about like the genial glossal muscle detaching from the tubercle that I took it really easy. And the myofunctional therapist I consulted, the only exercises she said I should do is like the cheek puffs. Yeah, take it real easy, relax the facial, soft tissue. And yeah, I was like I looked up some exercises myself and tried to do them myself, and then I was getting more lingual pain, and I'm like, no. I was taking it easy, but doing a little bit more mewing now, and maybe try some gum chewing. Whenever I chew something too hard with my teeth, I'm getting some pain in my teeth. Maybe it's a good thing. It's more like there's like some innervation now going on in my maxilla, because the pain is in my upper jaw. So, and my hard palate has more sensation. Before it was completely numb. When I put my tongue on it, I couldn't feel it. So I'm getting more sensation back slowly. Yeah, I'm interested to see what happens more with the myofunctional therapy. I'm quite interested in that field, as well as what is it called? I can never remember the name of this. It's not ortho. It's osteopath. What do they do? What is an osteopath? Like, what is this? So we'll see what happens there. So I'm not sure if I talked about this already, but I'll just talk about it a bit more about diet. So yeah, like first day, maybe 2 days, like it was tough to swallow, and my mouth didn't really open or move. So I was just syringing like apple juice, orange juice into my mouth by like 3 mils at a time with that little syringe. I think it was like a 30 ml syringe, I forget. So that was pretty tough, and I don't know if I was hungry. I was a little bit hungry. It was mostly like, what the frick just happened? Like, oh my gosh. And yeah, my mom, she'd crush up meds and put them in like Ensure, and I really liked that Ensure. That Ensure was good. So yeah, basically like for the first like, I don't know, 3 weeks, I don't know when. There's that video of me eating cottage cheese. I think that was like the first video. That was the first time I ate anything semi-solid. Yeah, I was on a diet of Ensure and Boost protein shakes, like meal replacement shakes. I don't think my mom mixed any protein powder in it, but like whenever I got, she left like within a week I was by myself, taking care of myself, and then I started blending protein powder into the Ensure and Boost, and that shit was good. Oh my god, I like that. I'm still doing that now because it tasted so good. And they're sweetened with stevia, which I think is okay. And also pureed soup. I made 2 of them myself. My mom made a couple to start off with, and just filling mason jars with pureed soup. And I learned that it's best to go simple. I don't need to put every single vegetable in it. I don't need to put every spice. It's basically like baby food. Just mash it up. I bought a really pro blender that just like destroys it. Destroys everything. I'm kind of scared of it actually. So yeah, Ensure and Boost protein shakes and pureed soup. That's the good stuff right there. And still kind of hurts to choose, but gradually, I don't know, week 4 maybe I started adding a semi-solid meal to my day, and then titrating it up from there. Giving my face a workout, because my face did get tired after a while of the chewing and opening my mouth. Well, I think I have good opening of my mouth now by week 6. And in terms of the semi-solid food, I had some cottage cheese, some Greek yogurt with a little bit of honey. Scrambled eggs, little omelets with some onions and mushrooms. Yeah, last week I cooked some chicken and veggies, and the chicken is quite difficult to chew, but the veggies are okay. I steamed them and I baked them. But yeah, okay, so the best protein shake: chocolate boost, spoonful of spoon of peanut butter, scoop of protein powder, and a banana. Chocolate banana peanut butter protein shake. Like, oh, I'm still eating that every day, and it's just so delicious. That's in the morning, and at night I add some turmeric with a vanilla boost and a scoop of protein as well. And turmeric goes good with vanilla, apparently. And it's good for like inflammation and healing, whatever. I don't know. It's okay. I think that's all I have to say about that. I was using the syringes quite heavily for the first couple weeks before I realized, oh, this is a pain in the butt. I can just start sipping things out of a cup now or whatever. But yeah, like I meant, like it was mentioned before in in some of the footage, that like my surgeon was really promoting chewing semi-solids like right after, and it just wasn't working for me. So I just had to take things where I was. So yeah, for DICE, drug-induced sleep endoscopy. Yeah, I don't even know if it's available in Canada. It's kind of like a whole big thing. You have to go to the hospital and get anesthetized while they do the scope. So it's not the easiest. It's somewhat invasive as a diagnostic procedure because you're getting put to sleep at different levels, I think. So they check to see where the obstruction is at different levels of sedation, I believe. It's useful to see what's actually going on while you're asleep, but yeah, if you just chop off half your face, you're just addressing every site, I guess, every level, if you're doing a multi-level procedure. And yeah, I'm not sure. It was never discussed with my ENT, and it was never heard anything about it around this area. And yeah, with sleep apnea in the literature, obstructive sleep apnea, they often use the Epworth Sleepiness Scale as a method for assessing disease severity. Like in a lot of studies, like if they're very severe, like over 10 in the ESS, that's like they'll exclude those people because yeah, they just definitely need treatment or whatever. Like the sleepiness is the main thing they look at as disease severity, when that's not necessarily true. Like I'm not sleepy. that often, because like with younger patients, you get more sympathetic innervation. You get like hyperactive, even though they feel horrible. Especially with kids, I believe, like the ADHD kids. And then there's also the decreased functionality. Like I'm not sleepy, but functionally, it's quite low. My FOSQ10 functional outcome of sleep questionnaire. It's quite bad. Yeah. So there's different ways to categorize or to assess OSA, disease severity, and they're all kind of useful, but they all have their flaws as well. So it's somewhat complicated. The AHI4, AHI3, ESS, FOSQ10, and then just clinically symptoms and comorbidities. If they're on a bunch of psych medication and cardiovascular medication, not like red flags. So it's August 9th today. It's 6 weeks plus 1. And tomorrow I'm meeting my surgeon. And I think he's going to take the elastic bands off and maybe unscrew the screws that are in my face. Or at least the ones in my mouth, I think they're called TADs. Temporary Anchorage Devices. I'm going to ask him some questions. Excited to see what he has to say. And, yeah, I had a little bit of a hectic day, So last night I took an allergy pill. I haven't taken an allergy pill before sleeping, and since the surgery. And I put the pressure a little bit higher on my CPAP, just like I was at like 6 to 8 before. So I think I put it 7 to 9. And oh my gosh, today I just feel so energetic. So I did all the things. I went to a couple of my previous work sites and just brought some Timbits and socialized a little bit. Met the manager, asking if they need any coverage lately. So I sent out an email. I ended up sending out an email to my boss saying I can't go back to work full time. I'd like to do some casual coverage, maybe 3 days a week. So it's like I pulled the plug. I was so uncertain whether I can do it, and I don't know. I'm just going for it. Who knows what's gonna happen in the future. But yeah, I'm riding high a little bit today, a little bit manic, hypomanic. It's stressful. It's scary. It's tiring. My chin hurts a little bit, so I'm icing. And I didn't exercise. I did some foam rolling. Yeah, just feeling overwhelmed with all the things that I want to do, that I'm feeling like I need to do, I have to do. I want to finish this painting project. I want to, fix my diet, cook some food, clean. I'm going back to work. I'm starting this course again. I have stuff to do, and I'm applying to the college, a different regulating body in another province. Oh, I have so many appointments with so many healthcare professionals. I think I need to make things more simple and give up. I'm not gonna paint for a while. I need to make another list. What is my priorities here? I need to get shit done. Hey, I think it's August 10th, and I didn't sleep right last night. Yesterday was really good. I went hyper a little bit, manic, and today not that great. Today is my 6 weeks plus 2 days visit with my surgeon, so I'm excited for that. I'm just waiting to go into the office. Very nice, like, clinic here at the big hospital. Fancy. And yeah, I guess maybe I'll take my elastics off, ask him a bunch of questions, see what's going on, see where to go from here. Yeah, really not feeling good today. Frustrating. So right after seeing the surgeon, and he froze everything, and then he took the screws out. And can you see? I can't even see the screws taken out. Maybe I'll take some better pictures later. There's a little open ones. I can't even see them. But yeah, it'll be good now that I have the screws taken out. More comfortable. Oh, you can see a little hole there. But yeah, I'm very numb here. Oh my gosh, he gave me a lot. But yeah, I felt a little bit when he unscrewed it, but it was very tolerable. I felt it like in my tooth. But yeah, I'm so numb, I'm relaxed, and like, my lips don't shut automatically, so I guess I always have to keep a little bit of tone. I just noticed. My mouth was like opening, now that my muscles are like have no tone. So that's just kind of interesting. So there's a little bit of a lip closure thing there. So it's good to use some mouth tape. I've been using mouth tape when I sleep. Here I am in the sleep study clinic. I have a room to myself. I'm very lucky. Very lucky. How did I say it? I have a room to myself. I have a room to myself. I'm very lucky. Oh, I hate being here. Oh, this is where it all started. 2 years and 2 months later, I'm back again. I'm very pessimistic about the results here, but also nervous, you know? Like, I saw the surgeon earlier today, and he was like, he was confident that he made a lot of space, and like, he was confident he resolved the obstruction, you know? So, I'm not that confident, you know? Because subjectively, I'm still very symptomatic. Headache in the morning, fatigue, difficulty concentrating, memory, so. It's better, definitely better, but I'm definitely not cured. Definitely not less than 5. And I don't even know if it was like a success as they define it in the literature, 50% reduction. I don't know, maybe 30 to 40% reduction. So initially, I was 22 events an hour in June 2020, and I was 180 pounds then. Now it's 2 years, two months later. I'm still 180 pounds. I dropped 15. I'd gone up to 205. That was my absolute worst. And then I dropped down to 195, and I just couldn't lose anymore. And then after the surgery, I magically lost like 10 pounds in a week, 15 pounds in a month. So I'm back at 180. In terms of body composition, I don't know about my body fat percentage. My strength is, I think I'm pretty similar. Well, I don't think I could bike as far as or hard as I did before, but I front squatted 175 for 3 sets of 3 today. 175? A plate and a 35. 205 pounds. Over body weight. Yeah. 205 pounds, 3 sets of 3. It was tough. My back was a little bit iffy. So yeah. So known confounders is just the time. 2 years, 2 months older,
as we age. Just, I guess, our tissue loses elasticity, things droop, losing water content and more fat content, I believe. Um, the incidence of OSA goes up with age, as I guess the AHI goes up with age. So that's a confounder. Another obvious confounder is my double jaw advancement of 13 millimeters and the genial tubercle advancement. Confounder right there. Confounder, what is this thing? Mute. I'm using a mute. Little nose prongs, keep my nose open. And yeah, just a change in nasal breathing that came from the jaw surgery. A little bit worse nasal breathing. And I'm on CBD oil now. I'm on 1 ml a night, I think. Honestly, the concentration is like sketchy. Like, I think it's like 40 milligrams or something like that. They never were able to answer my question when I asked them. And I took a melatonin, 3 milligrams. I didn't take that on my initial assessment. I don't think these things have an effect. The allergy, I took an allergy pill, cetirizine, 20 milligrams. I didn't take that back in the day in June 2020. Confounders. So there's some drugs there. CBD, melatonin, allergy pill. I have a lorazepam, just in case I'm not able to go to sleep. It's my rescue, and you know that one really relaxes the airways, so it might have an effect. Although I think I saw an RCT saying zopiclone doesn't change AHI. Any other confounders? Oh yeah, with the jaw advancement, like I learned this morning when my mouth freezes, I have some lip closure problems. When my facial muscles are relaxed, at least in this moment, maybe my face is a little bit tight. There needs to be a little bit of tone to keep my lips shut. So I use lip tape now. Lip tape is also a confounder. Make sure nasal breathing at least. And maybe some of the tongue exercises that I've been doing could help. I don't know. So there's that. All that shit. Ups and downs. I mean, I didn't really mention which way that they could confound the AHI. Some of them can increase it, some of them can decrease it. Who knows? Things are different. Life goes on, life changes. So, I'm nervous because well, the surgeon was saying he's very confident, like he made a bunch of space, and he did. Things are better now. But I'm just wondering, so if it shows my AHI is 0, it'll be completely invalidating about my subjective symptoms, my subjective experience, right? Because I feel like I'm still quite impaired. So it's kind of ironic that I'm kind of hoping for there to be some residual apneas just to validate my feelings or just what my experience is. It's kind of silly, you know. I'd love to be cured, but I kind of already grieve the lack of efficacy of the jaw surgery. You know, I went through that entire process after the jaw surgery, the disappointment, yeah, the unmet expectations. I had a lot of expectations. I made a whole rap song called Mr. New Airways.
MMA first line, that's for sure. It's a total cure or something like that. Not medically dependent on positive pressure. MMA first line, it's a total cure. It's not a total cure because I'm still on the CPAP. I'm still tired, sleeping 9 hours, and headache afterwards. So if the results magically show my AHI is 0, I'll be like, oh, fuck that. Like, I'm still gonna probably move forward with what I'm planning on: myofunctional therapy, lingual frenectomy, MARP, maybe reopening extraction sites. Because I gotta go with my intuition, and AHI isn't perfect. But we'll see what the objective science says, Like, just because it's kind of weird to say I'm hoping for, like, not a cure, like a result saying that I'm not cured. It's weird, right? But I don't know where I was going with it. It'd be nice if the objective measurement matched my experience. Well, we'll see. I'm curious, but like, there's the nerve wracking. Like, what is it like? What happens if I'm cured, but I still feel like symptomatic? Like, what is this? Like, is it all in my head? Should I go back on medication? Like, I don't know about that. So it's right after the sleep study, and you can see all the glue they put on me to put those cathodes on, and it wasn't that bad. The titration study I did like a year ago, I felt lobotomized after my sleep was so bad, but I think very low symptoms this morning. I had a very good sleep, so I think the AHI that'll show up, it'll almost be close to curing. So it'll be a bit of a confounder because I'm still symptomatic. It's very fluctuating day by day, as you can tell from the vlog.
Thank you.
And but I'm predicting it's pretty close to 5 for last night, which is good. Hey, I'm just using the jade roller for some myofascial release in my face. It's face is feeling kind of tight and tired. It's the morning after the sleep study, and I'm just wondering, like, why did I sleep so good that day? Like, what the hell? It fluctuates a lot, as you can tell from my documentation with this vlog thing. A couple of good days, couple of bad days. I'm getting more good days than I did before the surgery, that's for sure. But it's still up and down, and I don't know. I think it has to do with like my tongue tone. And also, well, yesterday I had my screws taken out, and I feel there's some swelling or edema in my upper hard palate, my maxilla, and then so it's a little bit lower or a little bit more swollen than usual, and it feels like almost easier to stick my tongue to it, kind of, because it's like clamping it in place, sort of. That's the kind of feeling I get. And I think I doubled my usual dose of CBD yesterday. I didn't end up taking an Ativan. I didn't need it, although I was tossing and turning a little bit, but I was able to fall back to sleep quite quickly during the sleep study yesterday. That is it. And there's this one study I saw where they're talking about the neurotransmitters that innervate the tongue, and they're postulating that if we give drugs that increase those neurotransmitters, it'll increase the tongue tone and reduce the sleep apnea. And it has been reproduced, but this one study actually found that to be the case. They had a pretty decent reduction in AHI by giving oxybutynin, an anticholinergic.
I forget what the pharmacology was, but I think like was it like acetylcholine innervates the tongue, so like inhibiting the acetylcholinestrases increases the concentration of the neurotransmitter or something, but it only works in conjunction with also something that also innervates the norepinephrine, the neurotransmitter, which also innervates the tongue. So you have to have both of them at once. So I figured like going into a new place and sleeping in a place that's not familiar might increase the norepinephrine, the amount of stress hormone or sympathetic innervation. So yeah, I had good resting tongue posture last night, for whatever reason, and yeah, I loaded up on there's that allergy pill, like I mentioned, and then the nose thing, and then the mouth tape. I still have the lip closure problem that I realized yesterday. Maybe the foam rolling will help. But yeah, I guess like I'm kind of kind of disappointed in a way because I'm predicting like because I slept pretty decently last night, my AHI is going to be very close to less than 5 to the cure, you know, and then like oh my surgeon will be like oh yeah total success, total cure, it's all good, you don't need to do anything else, but it fluctuates so much and subjectively my tongue still feels too big for my mouth. And yeah, still getting symptoms every now, a couple days that are very impairing. So, yeah, maybe like I'm myofunctional therapy, lingual phrenectomy, and the MARPy, but maybe not opening the extraction sites. We'll see what happens. I'm excited for the results. They come out in like a couple weeks, I think they're saying. So I just left the office of the second orthodontist that I've consulted. This is the guy that the first orthodontist referred me to because she was experienced with jaw surgery and breathing. And the first one was the one who did the palatal expansion with my siblings. So yeah, on the first consult, this orthodontist referred me to an orofacial surgeon for a consult. That took months to get in, and then I was supposed to see him after, and I don't know. Basically, they said they couldn't help me now because I'd already jumped 4 steps ahead, and they're like, they don't work with my surgeon or something like that, so they're like, I guess they don't want to deal with my bullshit. I'm like I'm not profitable for them. They seem very profit driven, this office, so I'm kind of annoyed. This was pretty horrible care right there, but I guess that's their competency. They had this book on the shelf, like the breathing, the new science of the lost art or whatever. So I don't know. He seemed kind of aware of OSA. He was kind of knowledgeable about it, but yeah, like it's kind of ridiculous that he doesn't want to that we weren't able to touch base at all. Anyways, this is what it is, so I'll go find a different orthodontist that can actually help me. Yeah, so like I kind of just got dropped as a potential patient at that office because I went ahead with a jaw surgery with a surgeon they don't normally work with, and I think that's kind of stupid. But yeah, I'm just feeling very irritable, and I asked my surgeon if he knows any good orthodontists that are airway focused, and he mentioned this other place, and I just called them, and they're booking out like 2-3 months in advance. So it's just like, what the heck? Like how busy are these guys? Like, how is it? It's just difficult to actually find someone to get me the help I need, I guess. I've already kind of had a plan or just have a way to move forward from there by then. Oh well. Hey, it's August 12th. I slept without the CPAP yesterday, but it wasn't that great. A little bit headache and just fatigue. I feel like my body wants to collapse. So frustrating. I wanted to mention my occlusion. You know, after the surgery, I felt like I think the surgeon looked at this side to maintain occlusion, like this over here felt like it was perfect. It was really, my teeth met each other, and this side felt all messed up. Like all my teeth were just like, no, that's not where they're supposed to be. But I think it's changed. Maybe like just with chewing and just resting against each other, like it doesn't feel that bad anymore. It feels like yeah, tolerable, comfortable. Not perfect, but yeah, it went back to okay. So that's pretty cool. I might not need braces. Well, at least till I do MARPE or whatever. I want to go back to sleep, but I know I can't because I already slept 9 hours, and I won't be able to fall asleep. I just got confirmation that just having work. I'm gonna go back to work in a few weeks. I tried painting, but it's not working. I don't know. I got tired of painting, so I don't know. I'm not inspired, or it just wasn't accessible, I guess. I'm gonna go gym now. So I guess I wanted to talk about like the patient-surgeon relationship a little bit. I don't know, my thoughts are a little bit scrambled about this, but I kind of see like a lot of similarities between like the parent-child relationship and like the God, like what is it, worshiper, God, normal person relationship, you know. Another any healthcare provider patient relationship, really. It's like we or like the child turns to the parents for care, safety, love. They just get their needs met, basically. Be safe. People turn to God for that. Patients turn to healthcare providers for that. And shit, healthcare providers aren't God. We're just dudes. So, you know, when bad things happen, we can blame God. Like, fuck you, motherfucker. Why are you hurting us? Why is there so much pain and sorrow and horrible things? You know, and I think maybe that's a healthy thing because, um, you know, the kid throws a tantrum. Hopefully, the parent doesn't react and gives them space to throw the tantrum, saying, "But no, this is how it has to be. This is how it is. You can't eat all the cookies you want until you throw up." What am I getting at? I don't know. I feel like there's just a tension. There's a tension in the relationship between the patient, me, and the surgeon. You know, it's just stressful. He's scared. Like I just the fear of pain, pretty much getting hurt. I think vulnerability. We open ourselves up. I have to open myself up. I'm trusting a guy after I met him like 2 times with my life. Cut my face off and stick it back on with metal. It's insane. And he's terrified of just like getting yelled at and saying, "Hey, you did a shit job, man." And just like, yeah, like that one of the other surgeons I saw, he was so like closed off and unwilling to be vulnerable to possibly like consider my case and actually help me. Like you have to open your heart to be able to help someone, I think, and it's scary and can be painful if people lash out and are abusive. And I don't know, like I think they're not lashing out abusively, but just complaining is a type of grieving, you know? Shit sucks. That's how it is. I didn't enjoy getting my face cut off. Lots of bad things, you know? And it's important. Like, I don't know. I felt like it was important just to say, hey, this is what's going on to the surgeon. And just have him, like, listen, not react. I felt like he was just kind of trying to
push it under the rug or just say, yeah, this is what we can do about it. This is normal. I don't know. But I like the fourth surgeon's bedside manner quite a bit in that brief interaction with him. He sat down right next to me. Like, I didn't want to get a CBCT. I was a little bit anxious about the additional radiation because I already got one. He wasn't able to open the disc on his software. And he's like, yeah, it's up to you. You don't have to do anything you don't want, you know. He wasn't forcing me to do anything. And I just felt like he got vulnerable. He told me how it is. He said it's going to hurt. But it's not reversible, so you want to make sure you're doing the right thing, and it will help with the sleep apnea. I just appreciated how calm and attentive, and I just felt kind of like he was there for me a little bit, you know. It'd be pretty cool, like if I could just pray with my surgeon or something like that. I don't know. Or just touch that fear a little bit, you know. In my job, as a pharmacist, the most invasive procedure I do is give flu shots, you know. And on the outside, I'm like, okay, I've done this. I know this is easy. Like, I've done this so many times, and no big deal. But on the inside, sometimes it's just like, okay, don't fuck up. Holy shit, don't, like, it's still pretty nerve-wracking. If I haven't done it in a while, you know, every flu season in the past, like, especially, I remember the first time, I never even mentioned it was my first time, I just did it, and it was fine. But although sometimes, like, I do it, and then there's like a blood vessel or something, and then, like, there's some blood. I'm like, ooh, it's not supposed to bleed like that. Where's the cotton swab? Shit happens, and if that's causing me that much anxiety and stress, I can't even imagine how much stress and anxiety, like, the surgeon must be under, cutting someone's face off, sticking it back on. So, advice towards surgeons is just to be real with the patient, give them as realistic idea as possible, so they can give as much informed consent as possible. Really outline the procedure well in advance. Like, I didn't like the last minute change in chin procedure. I wasn't able to kind of like consider it, go back and forth, ambivalenting, go back and forth on it a while just to consider if I really wanted to do it. So I just added to the anxiety, and I didn't know exactly what the procedure was. It's kind of like, we'll go in there and see how far we can advance you, kind of thing. So it's like, oh, okay. And just sit with the fear, you know. Like, I remember like on my 6-week follow-up visit, like, I was getting very tense, and we just talked, and like, almost sweating, and I felt he was a little bit, like, he moved his foot a little bit, like, a little jittery, I guess. But it's okay. Yeah, we connected, and that's fine. And he's a pretty cool guy. I like that guy. But that's it. It's August 13th today, and not the best sleep last night. I use my CPAP. I don't know if it's actually helping compared to the nights I slept without it. I feel the swelling's gone down in my upper jaw, upper hard palate from when they took the screws out a couple of days ago. So now there's like a higher arch, and it's more difficult to suction my tongue to that. So I have worse tongue position. It's falling back in the back of my throat. And I feel that the positive pressure from the CPAP
like it makes it more difficult to maintain that tongue suction to the roof of my mouth. There's more of like a pressure pushing it down, maybe. That's that's the rationale or the narrative, the understanding that is coming now from it. So I think I'm just gonna quit the CPAP for a while, see how that works out. It's scary because I'm just so dependent on it. I've become like, this is like my crutch, my lifeline. It's how I function. It's how I can sleep without being completely like lobotomized the next day. But that's not necessarily true anymore. So yeah, looking forward to when the bones heal in 6 to 12 months, and I can move forward with getting the MARPy, improve my nasal breathing more, space my hard palate for my tongue to suction to a little bit more intermolar width for my tongue to rest, open up the back of the airways. I'm also excited for the lingual phorectomy, so I can have easier time bringing my tongue to the top of my mouth. Anyways, I had a bad sleep, but I think I'm still somewhat functional today. I'm gonna go hang out with friends, might do some foam rolling or light exercise, maybe even some painting. So it's not perfect, but it's still better than before the surgery. So that's great. So it's August 14th today, and I've had a pretty good couple days. I still woke up with symptoms. They weren't the best, but I was still functional. I went up Grouse today in less than an hour, Grouse Mountain. Hung out with my roommate, got some good food. On the inside, I'm kind of like, oh, I'm so tired, I want to collapse, but I'm still I got some sympathetic innervation to let me go do some stuff, So that's awesome. And, yesterday I went to see some movies with friends. And I went for a walk around Deer Lake, so that's awesome. And, so last Wednesday I did that, the sleep study, and then the day after, I don't know, I don't know, I tried with the CPAP again, and I just woke up feeling worse than I did when I slept with this without it. So I'm like, oh, I'll just stop using it, and I don't know. Yeah, I haven't used it for the last couple days, and I don't know. It's okay, not the best, not the worst. I don't, like, I feel like my intraoral space it's still a little bit too small. My teeth are just too small. My tongue still falls behind if I don't have correct tongue posture, and it's very difficult for me to have correct tongue posture. It feels like my palate's too high up, and maybe the tongue tie is like pulling it down, and maybe when I use a CPAP, the positive air pressure is just putting another vector, pushing pressure on my tongue to push it down a little bit, something like that, having a bit more difficulty keeping in the proper position. So yeah. So it's official. I'm going back to work, and my course again is starting soon. This grad continuing professional development kind of thing. It's exciting and scary because I'm still very non-functional. When they already gave me some like pre-course like material to go through, and they said it should take 8 to 10 hours, and I feel like I've already spent more than that. I feel like it takes double to triple the amount of time for me to do anything as it does other people, just because my attention span is so poor because my sleep is so bad.
But at least I'm there and able to sit there and work on it, as opposed to before the surgery when I just was not able to get myself to do anything. So I called the sleep clinic and they said it'll take like 4 weeks for me to get the results back. So I think I'm just going to go ahead and post this part 4, the last part of the video series. And, subjectively, I slept really well that night of the sleep study, which is just weird, right? Kind of ironic. So I think, like, the AHI is going to be very close to being cured, less than 5. So I'll post the results of that sleep study in the comments for this video, just to have some type of conclusion to the story, I guess. And I still have a number of appointments I have like 3 upcoming appointments with different orthodontists. I still haven't found a good orthodontist that I trust to guide my treatment, my therapy. It's very frustrating. And yeah, we'll see what's going on. I'm moving forward. I googled oral myofunctional therapists and found I think there two people came up in the entire province, I think. So I made appointments with each of them, which is kind of stupid, but like I don't really trust healthcare providers anymore, so I always like to get different opinions. But yeah, these ones are a little bit pricey to move forward with therapy with both of them. But I think it'll also be a good experience and learning opportunity, and just to compare and contrast their procedure, their methodology, and how they assess my oral facial muscle function kind of thing, and what exercises they prescribe. So that's going to be a sequel video, myofunctional therapy and lingual frenectomy for obstructive sleep apnea. And then I have at least one good dentist that's familiar with MARPI that I trust, that can expand the upper palate and the lower palate, the lower teeth with Invisalign to match, untip the rear molars to match the expanded upper jaw. He said I can get 6 millimeters on my intermolar width, which I think would be really awesome. I expand my tongue, and I'm just thinking like 6 millimeters. That feels really good. It feels like my airways open up like with 6 millimeters. So excited for that, and also the nasal breathing benefit with MARPI. Excited for expanded nasal cavity, because like when I feel like on the sides, like I feel like the nasal cavity isn't the full width of my nose. My nose, like I think the bony opening is like in just like the middle of my nose kind of thing. So the soft tissue is overlapping the hard tissue, or I don't know how to, whatever, it's just wider. So and it's impairing my exercise performance subjectively, like while I'm awake. I feel like the nose can affect things more while awake, maybe, while as the retropalatal lingual is more sleeping. I don't know. And there's that review saying that the nasal obstruction with nasal procedures, like it affects a few points on the AHI and also sleepiness, so it does affect it a little bit. So yeah, I don't know if I'm gonna get the premolar extraction done, but premolar extraction space is opened up. I don't even know how that works, because when I relax my facial muscles, I already have lip opening. I'm still taping my mouth when I sleep, and I guess when I'm awake, I'm always keeping a little bit of tension in my lips to keep my mouth shut, almost unconsciously. So I don't know how that would work with opening up the premolar extraction site places, moving the front incisors forward. There's no room to move it forward, because then I won't be able to close my lips. So we'll see what the dentists say regarding the orthodontists say regarding that. but that'll be also another subsequent video. MARP for obstructive sleep apnea, plus or minus reopening premolar extraction sites for obstructive sleep apnea. And God willing, that'll be the end of it. Couple things I wanted to say. I think I'm regaining a sensation in my upper teeth. My hard palate was completely numb after the surgery, and I believe it's like slowly coming back in from the back towards the front. And now I have a little bit of sensation right behind my front teeth. Not fully, not like it's there though. It's coming back, and especially like when I'm chewing, I get like a little bit of like pain in my upper teeth, like they're sensitive. So that just tells me that like the nerves are reinnervating. I'm very happy about that. Hopefully, it'll come all the way out to here. The surgeon says something about nerve regeneration, like a millimeter from the base of the brain to like outwards. It expands for something millimeter per unit time. I forget what he said. I thought that was really cool. He was like quoting shit. I'm like, whoa, this guy is badass. He knows stuff. Upper jaw, lower jaw. I don't know. Still a little iffy on this. Crowding a little bit. Lots of pain. I'm getting like still a discomfort pain in my chin. Still numb lower left lip. We'll see. Maybe it's getting a little bit better. Pins and needles. Little sensation. Face muscles feel tired. What else? I don't know if I'll ever get like a functional rhinoplasty for obstructive sleep apnea. That'll be far in the future. It's the last thing I'm gonna do, if I do it at all, and it's also quite scary. Oh yeah, but my nose, there's the deviation and like well, it's improved. There's like I don't think there's much of a deviation anymore, but yeah, nose breathing is a little bit more difficult after the surgery. I swear I'm gonna find something to talk about that I forgot right after I sign out, and that's okay. I'll just put it in one of the sequels or squeeze it in somewhere. And in future videos, I'm gonna try to keep it like short instead of doing like a 5-6 hour thing. I just wanted to catch every moment just so I could like almost for myself keep my mind on track, document my experience, because my memory isn't that great anymore. And I'll probably do like a TLDR 5-minute thing. Hey, this is what happened. This is what I learned out of it. Yeah.